Hi, Dr. Cohen.
Great to see you, Mrs. K.
Thank you, doctor.
How are you feeling today, Mrs. K?
Please, doctor, call me Lee. We have known each other many years now through very tough times. Doctor, I've been doing much better these past 2 years on my AVASTIN. I just got back from a vacation with my husband and daughter. I've been a little tired, but other than that, we had a great time.
I am really delighted to hear that, Lee.
How do my results look from my last rounds of tests? How was the blood work and the scan?
Medically, you are doing great. Nothing has changed from the last tests, and it is exactly what we want.
Well, doctor, I am thrilled. As long as we can keep this up, maybe I can stay alive long enough for a new medication to be found. With all this medical research going on, someday they will find a cure. Or maybe multiple cures for many subsets of women. I have a lot of plans. My daughter Marilyn will soon graduate from university. I just can't wait for graduation. I always aim to stay alive long enough to see her on stage. I live for her and my husband, David.
Yes, Lee. We are hopeful that someday a cure will be found, but I have some unfortunate news for you.
What do you mean? You just told me that all the tests are looking good. So what are you talking about?
You were right, Lee. You were doing miraculously on AVASTIN. But there is a major problem that I want you to be aware of.
A major problem? What could be worse than my disease?
Look, Lee, I want to prepare you that you may no longer be able to use AVASTIN starting in July 2011.
Doctor, what are you talking about?
Well, Lee, the United States Food and Drug Administration has decided that AVASTIN does not work sufficiently well on average. And so they have pulled the drug off label.
Doctor, I am sorry to interrupt, but what in heaven's name are you talking about? No longer get my AVASTIN. Doesn't work? Averages. Doctor, you're not making any sense at all.
Lee, I am sorry. Let me try to explain more.
Doctor, you had better have a great explanation. This is beyond a cruel joke. What in heaven's name is going on?
The FDA gave AVASTIN accelerated approval in 2008 based on a serious trial. But they asked for more trials, and when they were completed, the FDA said that on average, the risks were not sufficiently worth it relative to the reward. So they decided to take the drug off label.
Doctor, you are really making me mad. What do those bureaucrats in Washington know about my medical condition? When it comes to my life, what right do they have to decide for me what is in my best interests? You and I make the decisions regarding my medical care, not some person who knows nothing about me. And I really resent the idea that they consider some average more important than my actual results. Doctor, this is crazy.
Yes, Lee, I understand that. I am very, very sorry.
Sorry? I am mad about this. What exactly does taking a drug off label mean?
It means that the FDA does not recommend this drug for usage.
So I won't be able to get the drug anymore?
Actually, I can prescribe AVASTIN for you off-label and you can still get it, but...
But what? If I can still get it, then that's great news. I don't care what the FDA averages are. We know that AVASTIN works for me, and that is all that counts. For a while, I misunderstood you and thought that I would never be able to get my AVASTIN again. My AVASTIN is keeping me alive. I cannot lose it.
But Lee, I need to finish. Even though I can prescribe the AVASTIN off-label for you, there is another major problem.
Doctor, you keep annoying me. You know how emotionally tough it is living with incurable cancer to start with. I don't need the FDA or you adding to my stress levels.
Lee, the problem is your insurance.
No, doctor. My insurance is great. We have been paying our premiums for years, and the insurance company has been super. Same patient, same medicine, same insurance company. Nothing has changed except the FDA making some silly decision. I'll call up my insurance and we will be all set. I told you, please stop worrying about this. You are really upsetting me greatly with all this. My AVASTIN is my security blanket, and any thought that it will be taken away is too distressing to contemplate.
Lee, you just don't understand. Once the FDA takes a drug off label, the insurance companies invariably remove their coverage. That's the real problem.
Doctor, there you go again. David and I worked hard for many years. We were never big spenders. We saved at every opportunity that we could. I know that David will be very supportive to use these savings to keep me alive. He loves me very much. I am the most important thing in his life.
Lee, it's not so simple.
Doctor, what now?
Do you realize that AVASTIN costs between $60,000 and $100,000 per year?
Doctor, I... Oh my heavens. What am I going to do? We'll soon be broke. I cannot do that to David and to Marilyn. They worry so much about me already. I cannot bankrupt our family over an FDA decision.
Lee, I'm so sorry. But there is one ray of hope.
Yes? What's that, doctor?
The manufacturer of AVASTIN, a company called Genentech, has decided to challenge the FDA. There will be a hearing to appeal the FDA decision on June 28th and 29th.
Well, doctor, do you know much about this hearing?
No, Lee. Let us both agree to do some research and get back in a few days. Does that sound okay to you?
Yes, doctor. This has been a tough visit. This is all that I can take emotionally right now. We'll chat in a week or so.
Thank you, Lee. Please give my best to David and Marilyn. You know how fond I am of all of you. You take care.
Thank you, doctor. I know that you only want the best for me and that your hands are tied by the government. I am not mad at you, you know that. Goodbye.